is Tony Brzezicki. I'm one of the joint chairs of the Croydon Commissioning Lead, and I've been a GP in Croydon since 1983. I think clinical commissioning led by GPs is very important. As GPs, we're well aware of the needs of our patients, and I hope that by understanding their needs, we'll be able to commission care that's relevant for them, more responsive for them, and closer to home than has been the case so far. Commissioning by GPs will be different from that from PCTs, in that PCTs have commissioned using experts in law and contracting skills, but without really understanding the care that they're commissioning. So care's been commissioned in bulk, such as a hernia, rather than really understanding who needs a hernia, who wants a hernia, and will it benefit them. So I think by understanding the clinical needs our patients have, we'll be able to adapt and commission care in a different way, looking at whether patients are happy from the advice they've had whether they need a hernia or not, rather than just how many hernias we've actually done this year. The vision for our emerging CCG is fairly altruistic. We want to make a difference and improve the health and welfare of the people we've been asked to look after and commission care for. So it's not just about trying to treat more heart attacks or strokes, but also to prevent heart attacks and strokes. And we also want to try and improve the feeling of well-being so that life is better, whether you're sick or ill, and not just have fewer sick people. So it's a pretty holistic approach, and I think in a way that's quite different from what has happened in the health service so far. Clinical commissioning is progressing well in Croydon. We started with 2 groups, but we've now merged into 1 group with a common vision and a determination to represent all of the people in Croydon. We have tremendous engagement from our GP practices and regularly have over 100 attending our open meetings. So we think we've made a very positive start. There's still a long way to go, but it is a marathon and not a sprint, but we feel we've made a very good start. Our priorities for commissioning Croydon, sadly, are first and foremost trying to resolve the financial situation. However, we have a number of work streams that we're already in discussion with local trusts and others to try and improve care. As well as trying to improve the pathways of care, we're looking at care in a much bigger way. So we're looking very much to integrate mental health, social care, community care, primary care and secondary care in a way that has been attempted elsewhere, but we think will be in the best interest of patients. Much of this supports the Better Service, Better Value programme that has been running in South West London now for 2.5, nearly 3 years. So an ambitious programme, but with really targeted outcomes for people in Croydon rather than just counting activity, which has been the previous aim of the NHS. We'd like to build on the achievements we've made so far. We have fantastic support from our GPs. We have a lot of good ideas, and we already have a lot of ideas and pathways that have been in place for some time. So we have excellent intermediate services in dermatology, gynecology, which has been a finalist in numerous HSJ awards, ENT, and all of those from multiple providers. We're looking at other ways of trying to improve care and patient experience, as patient experience is one of our biggest challenges locally in the care that our people receive. So we have a very good foundation. We have a lot of ideas on where we want to go. It's just trying to harness all of those together, bearing in mind where we are in the NHS. For that reason, our staff are absolutely critical to us. We feel very strongly that we have highly skilled and certainly very, very well motivated and determined staff supporting us to go through this process. And now we need to see how we can preserve that going forward with the new clinical commissioning support organisations, so that we don't lose that momentum and we don't lose that local knowledge.